It's a privilege to have you come to interview me in this short documentary relating essentially to the origins of the College of Medicine at the University of Ibadan, as well as the relationship between the college and the University College Hospital over the past several years. Now, the origin of the college actually in 1977-78 academic year, the federal government of Nigeria designated the Faculty of Medicine, University of Ibadan, as the center of excellence of medicine among the several universities that existed in Nigeria at the time. This designation was based on the previous performance of the college, or the faculty as it was at the time. It's the first faculty of medicine in the country. It has continued to remain very relevant and excellent in many ways, in research, in teaching, and in rendering medical services. So this was why Ibadan was designated then as the Center of Excellence for Medicine in Nigeria. At the same time, about the same time, the National Universities Commission set up a committee on medical education in Nigeria. That committee, after several meetings and discussions with stakeholders, decided that faculties of medicine would be best run under a collegiate system. The reason being that the Faculty of Medicine in many universities is much larger than any other faculty. For instance, in Ibadan at the time, the Faculty of Medicine had 25 departments, whereas many of the other faculties have 6 to 8 departments. So the faculty was very large. Secondly, the Faculty of Medicine is usually closely related to its associated teaching hospital. And teaching hospital itself is a semi-autonomous institution, autonomous really in finances, autonomous from the Federal Ministry of Health. Whereas the College of Medicine, or the Faculty of Medicine, was usually a part of the university, which relates to the National Universities Commission and through it to the Federal Ministry of Education. So the NUC Working Party decided that faculties of medicine would be best run as college. At about this time, that the Faculty of Medicine in Ibadan was designated Center of Excellence. Ibadan faculty have been considering also making moves to change the faculty status to college, because at that time, the Lagos University Teaching Hospital, which was founded after the University of Ibadan, the faculty started as a College of Medicine, and it was the only one that was called the College of Medicine in the country at the time. All the others existed as faculties. So the advantages of the college are very clear in that the college has semi-autonomy, is able to administer its finances, and is able to take certain decisions that are essential in its relationship with the teaching hospital. With regards to Ibadan, once this move came from the NUC and supported by the Council of the University of Ibadan, all the necessary machineries were set into motion, and the University Council at the time decided to use its powers to restructure the faculty into a college. And in June 1980, the then Faculty of Medicine was changed to the College of Medicine by the administrative action of the council. And it was the council that then appointed me, who was then the Dean of the Faculty of Medicine, as the first provost of the college. This was also based on the recommendation of the Faculty Board of Medicine, which recommended me to the council as the provost. And that's why I was made first provost of the College of Medicine, commencing 1st August 1980, having been dean for the previous 2 years, from 1st of August 1978 to 31st of July 1980. So I was the last dean of the then Faculty of Medicine and the first provost of the College of Medicine. At the time, the college was made up of just mainly 2 faculties, a faculty of basic medical sciences and pharmacy, and a faculty of clinical sciences and dentistry. Later on, as developments go, these other arms became faculties by themselves. So we then had the faculty of pharmacy, we then had the faculty of dentistry, a faculty of basic medical sciences, a faculty of clinical sciences, and later on, faculty of public health. After a number of years, the faculty of pharmacy left the College of Medicine to become an autonomous faculty of pharmacy, you know. So at the time now we have 4 faculties: faculty of basic medical sciences, faculty of clinical medical sciences, faculty of dentistry, and faculty of public health. The college was administratively, it was an administrative restructuring by the council of the university. And one of the things that we did to stabilize it is to ensure that a statute was passed by the federal government, a statute approving the establishment of the College of Medicine for Ibadan. The statute is a law, and the council can recommend to the federal government to enact a statute, which is like law. It has to be approved by the National Assembly and so on, and then it's incorporated into the university law. The university law governing Ibadan was then amended. So we were fortunate to be able to get this statute, but it took several years. It took me almost, or not me, but the whole of the university, but I was the leading point, going to Lagos, making sure that we met the Ministry of Justice to draw up the law according to the times, Ministry of Education, Ministry of Health, all the relevant people to get this statute done. But through God's grace, we managed to get it approved, and it was signed into law on the 25th of June, 1984, which coincidentally is my birthday, you know, but that was done. So from that time on, the statute establishing the College of Medicine became part of the University Act, and therefore it's not easy to change. For them to change that law, to change the statute now, they'll have to go through House of Representatives, Senate, so it's law. So that was one of the stabilizing factors to make sure that the collegiate structure was not easily tampered with. Now, under the statute, the college also has a court of governors. There's the University Council, and the college has a court of governors. The chairman of the University Council is the chairman of the court of governors of the college. The chairman of the board of management of the University College Hospital is also a member of the court of governors. So through this, we were able to again bring the management of the hospital and of the college together, although not in the not in the day-to-day running, but in terms of policy, because the chief medical director is a member of the court of governors. The chairman of the board of management is a member of the court of governors. The provost is a member of the court of governors, and representatives of the Senate and Council are members of the Court of Governors. Through this, we were able to have semi-autonomous, so whatever we can decide many things in the college, which the faculty of Agric, or the faculty of Social Science, or the faculty of Law cannot do, because they are faculties under the Vice Chancellor. Now, although the Provost is still under the Vice Chancellor, but he has this umbrella Court of Governors, which can decide on policies and implement the policies which are then implemented. That, to me, is a major achievement in stabilizing and making sure that the College of Medicine is not tampered with. Because again, another thing I should mention is that in 1986, I finished in 84, but by 1986, the federal government set up a visitation panel. As you know, visitation panels are set up for universities from time to time to look at the running of the university and see whether they are doing what they should do according to the law and so on. So in 1986, there was the visitation panel, set up for the University of Ibadan under one Justice, Boba Ado. And after they did their job, they criticized a number of things, the way things were run in the University of Ibadan. But they said the College of Medicine, University of Ibadan, was the best run arm of the university. They gave us kudos. And this was, of course, widely publicized in the newspapers. After finishing as provost in 1984, I went on sabbatical for 1 year, actually about 15 months. I spent time at the McMaster University in Hamilton, Ontario, Canada, in the 1984-85 academic year. I was visiting professor there in reproductive health. Then I came back, and after finishing in McMaster, Canada, I did another 3-month spell in Monash University in Australia, and came back to Ibadan in October 1985. Then I spent another year in the Department of Obstetrics and Gynecology in 1986, after which I left for the Kingdom of Saudi Arabia. I went as a professor of obstetrics and gynecology. I was in Riyadh for 6 years as professor of obstetrics and gynecology. You might have asked, why did I leave at the time? At the time, not just me, but a number of our colleagues left the country, just exactly as is happening at this time, because things have become not that good. Facilities were running down, and again, we couldn't maintain. You can't believe it, that even having been provost and chief medical director for 6 years, I couldn't pay the mortgage on this building, which we were building at the time. We needed money because the bank loan that we took, they took away all the money. And even as having been provost, chief medical director, I couldn't pay. So we got this job in the King Saud University in Riyadh, Saudi Arabia. And so I left as professor of obstetrics and gynecology there for 6 years. And during this period, I was also an honorary consultant to WHO in reproductive health. I was chairman of one of their major committees on injectable contraceptives of the World Health Organization in Geneva. I was also the chairman of the steering committee of the WHO infertility task force. And I used to sort of go for meetings and come back. But after 6 years in Saudi Arabia, the WHO offered me a permanent position as the program director for strengthening research capacity in Africa and the Eastern Mediterranean region, which is the Middle East. So I left Saudi and went to Geneva. And I was in Geneva for 8 years until my retirement in June, at the end of June 2000. The WHO and other UN agencies, you retire in the month in which you attain the age of 62. So I retired at that time, but I did 8 years. And during this period, I made sure that facilities in many of our reproductive health institutes in Nigeria they benefited. Ibadan being, of course, the greatest beneficiary And Lagos was another one. We also established a center in Shagamu, the hospital there in Shagamu. The Obafemi Awolowo University Hospital in Jos, and in Ahmadu Bello University. So we had nuclear centers of reproductive health, training and research. And we managed to make sure that a lot of funds came, not only to Nigeria, not only to this, but Nigeria was a major beneficiary in the big country like Nigeria. So we had 6 centers which we developed using a strategy called the Long-Term Institutional Development Grant. Now, this grant was also given to several other institutions in Africa, in Nairobi, in Cameroon, in Cotonou, Benin Republic, in Ghana, in Cote d'Ivoire, in Ethiopia, Egypt. As I said, it also covered the Middle East. So we had centers in Egypt, in Tehran, in Karachi, in Pakistan, in a number of other centers that are throughout Africa and so on. So I was responsible for this for 8 years. And when I finished, I retired, the director of the World Health Organization in Africa appointed me as the chairman of the WHO African Regional Task Force for Maternal, Child and Neonatal Health. And this I did for 5 years, from 2000 to 2005, even though I've retired. So look at the involvement with WHO. And through one's connection in WHO, a number of our colleagues, many of them, were given research training grants to train abroad and for research grants, many of them. And we're really proud that Ibadan continued to do very well. In particular, Professor Akande was a major beneficiary of WHO grants, and for which he did extremely well. Benin too, Professor Friday Okonofor, and also here Professor Jembe. There are many of them, so many who did so well, and we're really proud of them. Professor Kawede Dada in Shagamu, they're always talking about him in Geneva, that whenever there's a research to be done and we're looking for people to do it, Nigeria always provided people. Professor Joe Tubo in Jos was extremely good. And so many, I can mention their names. They did us proud because they excelled, they delivered, and we were never really sorry that we were really quite proud of them. So WHO was a good place from which I worked and retired, and then I came back here. And a few years after that, 2003, I was made an emeritus professor of obstetrics and gynecology in the Department of Obs and Gynae, where I still remain till today. It was quite, when I left, it was beginning, and many more people left. In fact, after a number of years, you could hardly count any of the consultants on. In fact, one of our colleagues who came a few years after I got there said it was becoming an embarrassment to be seen on the corridors of UCH, because people say, oh, that man, if his papers are complete, he won't be here. Because, I mean, first of all, the facilities had run down, they were not well maintained, the salaries were extremely poor, and so on. But that is the brain drain part. Now, the brain gain part is the part I've described, in the sense that after a number of years, and not just me, a number of others like Professor Ladipo, who also went to South and so on, went up and were able to bring things back to the country. We were able to get grants for research, for training, and so on and so forth. In fact, sometime at the beginning when I went, people were saying, oh, provost, in fact, it came out in the newspaper, one of the provost of the former provost in Saudi Arabia was news. And my other colleagues in the department in Riyadh they said, oh, you must have been very important. I said, no, I'm not. They're only just jealous, because some of them have left. We had Germans, we had British people, we had other people came who were there. They said, when we go, nobody has even known we left the country. But here you are in the newspaper that they are talking about you. So, but towards the end, even when I went to WHO, it was now, people were saying, just stay there, please, because we need you. We need you, because at least we were able to bring things back to the country. We were able to get research training grants, research training, research for projects, and so on and so forth. That is part of the game. I think there's still something there, in the sense that when people go, your mind is still back home. You still want to bring things back home. You want to do things home. And this is there. So I'm not worried. I have a feeling that by God's grace, all these people who have gone will bring things back home that we'll be proud of, you know. And at the end of the day, if they are here frustrated and they can't walk and they can't do anything, they can't even look after their families, to whose benefit is it? No. So in a way, it's a good thing. In fact, also I must mention, in terms of family now, 2 of my children graduated from the university, from the College of Medicine, University of Ibadan. My daughter graduated in 1991 here, university. She's a consultant geriatrician in the UK right now. And another son of ours graduated in 1994 and is also now a consultant psychiatrist in the UK. But both of them are coming home regularly. In fact, my daughter has just established in Lagos a JBS gerontology center to look after old people. It's the first of its type. In fact, the official opening will be very soon. If she comes, she spends like 2 weeks here and 2 weeks back there. It's a lot of strain on her and the family. But this is because they feel that they must put something at home. And I'm proud of that. My son also has a center in Lagos. You know, he left only last night, arriving back in the UK today. You know, and they keep coming and going. So I don't think that people leave the country, live out of lack of patriotism. They live for various reasons. But I think it's for us to make sure there is a push and the pull factor. The push factor is what I've described, where salaries are not enough. I couldn't pay the mortgage on the house. I needed to build it. I needed to do it. There's no other way other than to get legitimate earnings elsewhere to bring it back, and the country gains by it. And the pull factor, of course, is the fact that they're able to do more things over there. You know, facilities are better and so on. But so will it be here. So in point of fact, brain drain can become brain gain. And this is what we believe will happen.